What I'm going to look at is, first of all, an introduction about why parenting and a little bit about parenting of adolescents, to talk about what are parenting interventions and what kind of evidence do we have about their effectiveness. Can they be helpful with the most vulnerable children and families? What sort of ages do they work? There's a huge policy focus on early intervention. Does that mean that it's too late by the teenage years? And then finally, are these interventions applicable to foster carers? The same interventions that are helpful for birth parents dealing with their kids? And what does the evidence from parenting trials about foster care parenting skills training suggest? I have to confess I'm not a fostering expert, and I'm not a teen expert either. I do parenting interventions in general. Since we're talking about personal experiences, I'm the sort of worn-out bad parent of 4 teenagers, which is difficult, and it made me think when we were hearing from the care leaver about the sort of gaps between old people and teenagers. First of all, why parenting? This is pretty obvious, but just to remind people of this, parenting skill is one of the strongest predictors of good outcomes for kids. There's been many longitudinal studies that show that positive and consistent and supportive parenting predicts lower levels of childhood and teenager problem behaviour, and also a lower incidence of child maltreatment in the family. And conversely, harsh and inconsistent parenting is predictive of poor youth outcomes such as delinquency, drug use, child abuse and neglect, school failure, poor mental health, and even partner violence in the next generation. And parenting seems to be a key mechanism or common pathway through which a number of contextual stressors, such as poverty and abuse and so on, may impinge on children. And good parenting seems to be able to protect children in the face of these stresses. And then the other good thing about parenting, I suppose, is we know quite a lot about how to help with it. It's possibly one of the most researched areas of interventions for families and young people. If we think about parenting teens, then there's a number of core elements of good parenting at all ages, as John was talking about. Things like having a relationship that's warm, nurturing, fun, with good communication, providing security, clarity of expectations for the young person, setting limits and so on. And all that's important for kids at all ages, but more specifically in the teenage years, then as John talked about, that very difficult balance between autonomy versus structure and control, the need for greater monitoring and protection of kids as they get older, whilst at the same time allowing them to make their own decisions. New levels of independence leads to new opportunities and risks. You've got the peer group doing much more of the socialising and the family less of the socialising, and then you've got neighbourhood and community influences that surround those peer groups. There's a whole load of new parenting skills. Negotiating, listening is pretty difficult, and of course monitoring those risky and other situations. And of course the context of adolescence has been changing over time. Adolescence tends to start earlier these days, but in some ways it goes on for longer. Many adolescents are dependent for longer, and people talk about the notion of an elongated adolescence. And then there's new things that have to be negotiated, such as cyberspace and so on. And I guess I've been thinking about the sort of clash, if you like, or the negative attitudes towards teenagers that we were talking about. And some of those come from teenagers being different because of generational change, standards of behaviour changing, the whole context changing and so on. But I guess some of them are just about our attitudes changing as we get older. And if I think about the things that really that cause conflict with my teenagers, then they're all things that were happening when I was a teenager too. But I guess we have a different perspective on those things now, and perhaps a different perception of risk, and so on. But it is puzzling that we could often as adults find teenagers so difficult when many of the things they're doing are just us, the same as us all those years ago. So it's a puzzle. Anyway, what about parenting interventions? What are parenting interventions? Well, this is a nice little diagram about the elements of a parenting intervention that comes from Webster Stratton's Incredible Years programme. And she represents the elements of parenting that people learn in these interventions as a pyramid. And the importance of the pyramid is that the things at the bottom are what you do most of and what you start with in building relationships, or indeed in trying to repair relationships that haven't been going terribly well. So this is the sort of foundation, is promoting a good relationship between the parent and the young person. Moving on to building social competence through encouraging appropriate behaviour through incentives and praise and so on, and then on to how do you prevent and then deal with more troubling behaviour, limit setting and various techniques for dealing with troubled behaviour. Now this has been written primarily for children rather than teenagers, but I mean really the principles are not different, and I've tried to think about what typical teen parenting programs put into their interventions, and to copy this pyramid diagram again. One of the very nice adolescent researchers who's done a lot of intervention work as well is Tom Dishon from Oregon, which some of you may have heard of. He's also famous for looking at the harms of interventions and the way that bringing peer groups together can potentially mean that intervention effects make kids worse rather than better, because of bringing troubled teenagers together in ways which they wouldn't have otherwise done. But anyway, if we think about how do you promote positive relationships with teenagers, then that may not be through something that we would call play, but instead about other kinds of shared joint activities, the importance of better communication, listening, problem solving, and so on. Incentives are very important, but as kids get older, then thinking about the kids' autonomy, then there's going to be more negotiation over what's expected of the young person and what those incentives might be. Obviously, ideally, you want the negotiation to happen kind of at the outset rather than during the middle of an argument, which doesn't always work so well. And then limit setting and monitoring, with much more focus on monitoring what the kid's doing when they're not there. But partly that's about building good communication and listening in the first place, so that the kid would want to tell you what they were doing. And finally, some kind of consequences for when rules at a certain level have been broken. And those might be withdrawal of privileges or whatever. And in younger kids, people often use time out as a last resort, but obviously that's not generally thought applicable for teenagers and older kids. When we get enthusiastic about any interventions, then I think the first question we ought to be asking about existing interventions especially is there any evidence that they work? Because it's very easy for things to look nice, and that's not the same as whether they actually make a difference to people's lives. So what constitutes good evidence for parenting interventions, or any other social interventions for that matter? Well, the randomised controlled trial is considered the gold standard for really trying to get at really what works in interventions. And these are pretty well worked out methods, even for complex social interventions. And the views of participants are pretty central to the evaluation in any of these kinds of trials. Some people object to randomised controls because they're expensive. And of course, good quality evaluation is expensive, but ineffective or untested practice is even more expensive than doing the research in the first place to work out if it works. But it's one thing to think that an intervention, if we don't know about its effectiveness, may just not work. But of course, it's quite possible that an intervention may do harm, and unless we've evaluated it properly, we can't tell. And it might sound unlikely that well-meaning interventions are harmful, but actually there are quite a lot of examples in the literature of well-liked and popular interventions that were often very acceptable to users, both to young people and to parents, that do harm. And especially in the field of interventions for troubled teenagers, there's quite a lot of interventions that have done harm, including most of them are ones that are based on some kind of coercion. For instance, boot camps and things like that don't seem to work, or they don't. The systematic reviews of the randomised trials suggest that they don't work. But there are also other interventions which try to lecture or exhort young people not to do things. Those ones often don't seem to work. So there's quite a lot of classes of interventions that may be ineffective or actually harmful. And then an important method for evaluating interventions is to systematically review the evidence from separate trials that have evaluated the effectiveness of intervention. And these are really important. They can be rigorous, transparent, replicable, up to date, and provide very useful messages for policy and practitioners. Many of you will have heard of Cochrane and Campbell reviews, and they're some of the best known, more rigorous types of systematic reviews. They're all freely available on the web for people that want to access these. For instance, there's a Cochrane and a Campbell review of treatment foster care, of youth empowerment programs, which John might be interested in, and many other areas of many systematic reviews of parenting interventions in child protection systems for teenage mothers and other groups and so on. So what does this evidence based from randomised trials say about parenting interventions? Well, generally that well-structured ones based on social learning theory, like Incredible Years and so on, seem to work well for reducing child and teen conduct problems, and this includes in clinic-referred populations in mental health services, kids within youth justice services, and in other kinds of high-risk samples as well. And they also seem to, not surprisingly, work for improving parenting skill and confidence, but also parents' mental health has been improved by many of these interventions. There's many good systematic reviews that I recommend people to look at, and many replications of these intervention trials, these randomised trials, by independent teams away from the people that actually developed and perhaps sold the programme. And these have been done in multiple countries in Europe. So with all this evidence, we might ask why we would want to use interventions without an evidence base, because it's less likely to be cost effective, possibly may not be ethical. And certainly we could say, why would we have lower standards of evidence in social and family care than we do in health care? And yet we do. And then in what service contexts have these interventions been tested? Well, they've been used with a wide range of families and settings and modes of delivery, in health services, in schools, in youth justice, in child protective services, in the voluntary sector, and so on. These are just the settings for the randomised trials. There's even more settings in practice where these interventions are being actually implemented. What about delivery methods? Well, parenting interventions can be delivered to individual families in the home or in a centre of some kind, or to groups of parents. And they can also be delivered through electronic means. Some people have trialled interventions that are done on the phone, or using TV programmes or the internet, and so on. So there's a lot of room to adapt the interventions to the family's level of need and their preference, and to service and cultural context. I have to mention a computer game. It's totally irrelevant because it's an adolescent depression intervention, but it's so wonderful. There was a randomised trial in New Zealand of a computer game called Sparks for teenage depression. It's teaching cognitive behaviour therapy techniques for dealing with depression to young people with quite severe depression. And I think that, there are also things like that in the parenting field as well, not the computer games, but other kinds of interactive stuff. I just had to plug that one because I think it's so good. And what kind of families are these interventions useful? Now, have they been tried all with middle-class white families, or all sorts? In general, the answer is that they seem to be effective with families living in poverty and more average families, but also in many cases for families with quite complex and multiple needs, such as, so there have been trials that have shown effects on maternal mental illness, on families where there's adults or the young people who've been in the justice system, and also with parents who are currently or recently have been prisoners. They seem to have some effects on other problems that kids have apart from disruptive behaviour, such as depression attention deficit problems. And there's a lot of quite optimistic studies, actually, where within a randomised trial, people have looked at whether the kids who have more problems within that trial have better outcomes than those who have fewer problems. Now, we might expect that it was easier to deal with the kids that have fewer problems than the ones that have lots, because that's what it feels like when you're working with a family. But actually, most of the data suggests that it's the most difficult kids that do best out of these interventions. Obviously, these kids have further to move, but they're also the kids that would have done worse without the intervention. And of course, in a randomised trial, you're always comparing how kids did in the intervention compared to those that didn't get it. So I think there's quite an optimistic picture. 5 minutes, right, okay. What about teenage programmes? There's quite a lot of teenage programmes that have been evaluated. The evidence base is more extensive, though, for younger kids. And some examples of evidence-based teenage programmes include strengthening families, functional family therapy, which has often been used in youth justice systems, as well as with kids referred to mental health services, multisystemic therapy, Tom Dishon's adolescent transitions programme, and so on and so on. There do seem to have been some problems, however, in transporting some of these well-known programmes to new countries. And randomised trials in Sweden and the UK have found that some of these American programmes didn't work so well in the UK when they were tested in randomised trials, including functional family therapy, multisystemic therapy, and a recent trial of treatment foster care. I think the jury's still out on whether these things do work or not. And you might say, well, why would we expect them to work? They're American programmes and the context here is completely different. But I don't actually think that's the answer, because when you look at younger children's programmes for parenting interventions, for quite high need families, we recently did a systematic review about how well these programmes work when they were taken to a new country. And these programmes seem to work extremely well when taken from the US to countries in Europe, but also to some countries in Asia as well. So I don't think that generally it means we can say that an intervention doesn't transport well necessarily from one country context to another. But why these particular ones are not transporting some of these high-end teenage programmes, we're not quite sure. That's right. There's a lot of policy focus on early intervention, and it seems to me the implication of that is almost saying, is it too late when it comes to teenagers? It's interesting, people have got Nobel Prizes out of saying this kind of thing, that early intervention is important. And there's a lot of neuroscience and sometimes pseudo-neuroscience saying that there are critical periods in development and that so intervention must happen early, otherwise we've lost it. But when people get their Nobel Prizes for saying this, did they ever actually look at actual intervention evidence for a particular intervention? And if we took the one with the most evidence behind it for young people, which is parenting interventions for reducing problem behaviour, if they actually looked at the data from those trials and asked, do you get better results with older kids or younger kids, looking both across reviews and within reviews, then I wonder what the answer would be. Well, I just did a very quick and dirty search to find out this. And I started with looking at kind of well-known reviews for Cochrane and Nice about parenting interventions for parenting interventions for behaviour problems. And if the early intervention thesis is right, then you should have the highest effect sizes in the little kids, and the next highest in the sort of primary school age, and the lowest in the teenagers. And when you actually look at the effect sizes from these very rigorous reviews, it doesn't look like that at all. The lowest effect sizes are in the youngest kids. There may be lots of reasons for this, but it doesn't fit with the early intervention hypothesis. And then you've got these quite good effect sizes in middle and late childhood. I don't know what to make of this. I'll skip the next few slides, which does the same analysis in a different way and finds either that interventions are more effective with older kids or that there are no age effects. It may depend on the type of intervention and all sorts of qualifications, but there's no resounding support for the early intervention hypothesis. Now, if parenting interventions work well to reduce family conflict and improve problem behaviour in birth families, then are they helpful for foster families? Well, here the evidence gets more I think, more and more mixed. And I'm not an expert in this evidence, and I hope there's going to be other speakers coming to talk about this on another occasion, but anyway. But a Cochrane review a very nice Cochrane review by Geraldine MacDonald in 2007 about parenting interventions for helping foster carers to manage problem behaviour. She found 6 randomised trials of these interventions that met her criteria, and sadly she concluded there was no evidence of beneficial effects on child outcomes or caregiver skills or mental health. And one intervention by Helen Minnis seemed to do more harm than good. And this was a more attachment-based intervention, so sure what that's about. Many of the trials had hugely differing age ranges of the kids, and it would be good to look at whether age effects are any different when it comes to foster care children or not. It's not quite as pessimistic as that, because some recent foster care trials did show more promising results, and a review by Festinger in 2013 found quite a lot more trials by now. Some good randomised trials, some with weaker designs, some are looking at so-called pre-service training, so when people are getting approved for foster care, as well as the others looking at, while you're in the middle of dealing with the kids. And interestingly, 2 of the recent randomised trials were of the Incredible Years group parenting with foster carers. And one of them I thought was very interesting by Linares in the US, which looked at how you could work on co-parenting between foster carers and bio parents, which sounded tough but really worthwhile. So, and they got improvements in parenting skill in the Linares one, but in child behaviour and carer depression in the Bywater study, which was done in Wales. So why these rather mixed and not very promising findings when you apply these very effective interventions for other troubled families and kids to foster care situation? And Geraldine MacDonald has a nice speculation about why it might be. She says that foster care... Am I okay to have another 2 minutes? Sorry, right. The foster carers seem to really like the programme, so why would they have no effects on parenting skill or the child behaviour? Was it not intensive enough? Possibly yes, because the foster carers said how overwhelmed they felt by the problems, but of course that's to some extent the same in other populations. The carers didn't get enough ongoing support for behaviour management, needed it for longer. Some of the things they wanted to do, they weren't allowed to do by the local authority policies about how you manage children's privileges and things. Perhaps the attachment relationships are just too difficult to rebuild. Perhaps it depends more on age or placement history. So I think this is an area that perhaps needs more careful systematic reviewing and research. So conclusions. Parenting interventions have a strong evidence base from randomised trials. They seem to work across different ages, family types, cultures, countries, and including multi-problem families and youth. The evidence base is weaker and more mixed for teens, and there's poor success of some well-known imported teen programmes, but good results for imported programmes for younger kids. And yet at the same time, when we're not talking about these imported interventions, there are very hopeful messages from systematic reviews of intervention age effects, and they show that early doesn't need to be any better, so that therefore later is definitely not too late. The foster care findings are very mixed. Why? What are the more promising approaches? How can they be improved? Can we build on their partial success? Since we know a lot about parenting interventions, but what are we not getting right in when it comes to foster care? Or could it be that the mixed success of these trials is not actually specific to foster care families, but is it a mixed pattern of findings in teenagers in general that we're looking at? Thank you.